But I think one of the biggest one that I have found in Region 1 is the lack of organizational commitment of support. And when I was talking to Mary and some of the colleagues from the Iowa Initiative, I asked, who was going to be sitting in the audience? Are they decision makers? And they said, yeah, a lot of them are decision makers. Because if a decision maker is not going to, you can have champions in your clinic, you can have champions in the community, but not until the people that make decisions, nothing is going to get done. So to me, if I stress anything else around the barriers, that would be one of them. And then I know that limited financial resources is a big barrier, but I think that some clinics, the way that they have not gone around it, but in terms of collaboration, when they collaborate with other organizations that maybe already have interpreters, so they borrow each other's stuff, So what are some ways that it will not going to be so costly for your organization to embark on this? The biggest one, and is the one that perhaps we see around the country, is fear and resistance to change. Fear, it can be in both ways. It could be because I fear the unknown or fear populations that are coming in and taking over, but also fear that I may not be good enough. And I think that sometimes that is one of the biggest fears that we have found in providers, like sort of what our good friend Rachel said a few minutes ago. It's like, they said, oh, you're just a white girl. What do you know, right? But no, when you really have the desire and the tools, and that's what you need, and the competence, you are able to do this work and do it well for your community. How long do I have? All right. All right. So I'm going to tell you a story because as Hector says that good stories are the best way to illustrate how you go or create processes within a community or an organization. So I want to tell you a little bit about the story of Lawrence and the work that I have been doing there with other colleagues at JSI. Health Quarters is a Title X grantee of the Region 1 Family Planning Training Center. Some of you know the executive director because she has been there forever, and but she gave me permission to talk about the work that they have been doing. So they have been working mainly in the city of Beverly, and then they decided that they wanted to reach out more to the Latino community. And so then they decided that they needed to actually hire people from the community so that they could go out and do the outreach. Not only that, but then also they went sort of like through this process of the 5 strategies that I just gave you. And so they decided also that they needed to do focus groups to find out exactly what was the mindset of the community itself around reproductive and sexuality issues. So let me tell you a little bit about Lawrence before we begin. So Lawrence is one of the oldest planned city in the United States. It was founded in 1847. And then it had been drawing immigrants population since then, and mainly because of the paper mills and some other industry like that. And so there have been a whole bunch of different waves of populations going through. And then what we have now is a current population that is 70% Latino. I know that Lawrence wouldn't like me to say this, but it is one of the 25 poorest cities in the country. And then the median family income is a little bit more than $26,000. And then 29% of the families and a little more than 31% of the children live below the poverty level. And 64% speak a language other than English at home. So it's very diverse and there's not a lot of resources. And JSI have been working in not only with health quarters, but then also we have been doing a lot of community research, and that's how we were known. And so when we went in the community, we already had rapport with a lot of the gatekeepers, as we call them. These are the barriers that to access reproductive health barriers. We have language, literacy, education, the culture, and as we have mentioned in this room, documentation or immigration problems. And then also, most can't afford health insurance, and this is sort of interesting because Massachusetts is one of the states that requires that everybody should have health insurance. So it's very difficult for people to afford health insurance. And then many have pre-existing conditions, diabetes and some others, and they live in poor housing and also have high hazard jobs. So this is where Latina Rompiendo Barreras de Salud came into existence. This is the program, and it's Latinas Breaking Barriers of Health.